Are you yourself or someone you know around you really having a difficult time dealing with OCD related issues? Stay tuned for this episode of Spirit Left. Alessandra, such a pleasure to see you again, and such an honor to always have you on Spirit Lift. You're so incredibly knowledgeable, insightful, have so many interesting advices for people overall, as we always do in having these discussions with you. And I really thank you for being on again. And we're going to be talking this episode for all our viewers and listeners about OCD. And why? Because we're filming this, recording this in 2021. It seems as the pandemic has really, gone on for so many months now throughout the world. Maybe some could say getting better in some parts of the world, others not. However, I think people's certain I don't want to say really necessarily bad habits, but certain habits that are just putting them in a loop that they can't get out of, one of them being OCD, has really accentuated and gotten worse, I think. So I think, for me personally, I think it's something I deal with to a certain degree. So I'm really interested to talk to you about it. So Alessandra, thank you so much for being on Spirit Live again. And can you just please give our viewing and listening audience a kind of comprehensive definition from your point of view? What is OCD?
Sure. OCD, obsessive-compulsive disorder, is a mental disorder characterized by two things: obsessions and compulsions. What is an obsession? An obsession is an intrusive thought that's repetitive, and it creates distress in the person. What is a compulsion? It is the action that someone does to control or reduce the anxiety created by the obsession. Now, there are different kinds of obsessions, and they all cause significant distress. They're all intrusive and unexpected. Now, among the kinds of obsessions that there are obsessions related to contamination, resulting in some illness or even death, or making mistakes that will result in some kind of catastrophe. Another one would be the loss of control, resulting in serious damage to oneself or somebody else, and thoughts related to perfection and symmetry, in which if there isn't that perfection, there isn't that symmetry, again, something very bad is going to happen. And there's another one related to superstitions. Most of the obsessive thoughts fall into one of these categories.
That's very important to know, actually, that there are categories or degrees of it, right?
Both. There are categories and there are degrees. You can have different, just like in most things, especially mental disorders, you have varying degrees of a certain illness. You can have someone with a mild case of OCD in which their lives won't be as affected, and there will be severe cases in which their lives are wrecked by the illness.
Alessandra, just following up with what you were just commenting on that, especially the degrees and everything. And also, we caught my curiosity. You mentioned mental disorder. Is it like, when I think of mental disorder, I think like my brain doesn't work anymore, or my wife would say that, depending on our conversation. But is it really is it in some sort of deeper degree or like understanding an actual mental disorder? Is it, qualified as that?
It does fall within the mental issues classified within the Diagnostic and Statistical Manual of Mental Disorders, which both psychiatrists and psychologists use to diagnose and to classify different problems their patients may be presenting.
What I think like a kind of representative example of maybe the quote unquote extreme version of someone with OCD would be like Howard Hughes, right? And I mean, I saw the movie.
Definitely.
Yeah, I saw the movie where Leonardo DiCaprio portrayed him. I think it was called The Aviator. I mean,
yes, exactly.
Whether historically it's completely, in line with his actual history and who he really was, I don't really know, to be honest. I'm not gonna make that judgment. But the point is, in any case, he was. If anyone had seen that movie, he kind of presented himself of really, really, especially towards the latter part of his life, having a really extreme degree of that, and affected relationships, that affected his
everything,
a lot,
his work, his relationships,
paranoia,
everything.
So is this something that you need to really see?
He became a recluse.
Yeah, you become is this something you really need to seek out and try to, if you do? The thing is, I want to ask you about this idea of recognition. Do you have to try to figure this out for yourself if it's something that you are dealing with it, so those mental loops don't get out of control? Or how do you go about like trying to, calm down OCD tendencies?
Well, fortunately, obsessive-compulsive disorder, even though it is a very common problem, it is very treatable. And one of the things that help us make it treatable is that because it causes the person distress most of the time, they tend to be aware that they have a problem. And they try to seek some kind of help, which helps us a lot, because if a person doesn't recognize they have a problem, they're never going to get help, and they're just going to get worse. But if they're seeing, okay, it takes me 3 hours to get out of the house in the morning, and I'm constantly late to work because I'm washing my hands 2,500 times, or because I have to count how many times I open and close the door. I have to go and come back to my house 3-4 times to make sure that it was properly locked. I go 25 times to the kitchen to make sure that I turned the stove off. So it really causes problems that are not that easy to deny, especially obviously the more severe cases.
Have you noticed maybe people with OCD like have problems or have tendencies to go into certain, like, to deal with it, like certain outlets that may be detrimental to them? For just an example, let's say, as an example, I have to wash my hands a certain number of times a day and clean the house a couple times a day or whatever, but it drives me like, I know I can feel it in my body. It drives me crazy. I do that and I don't like it. So to minimize me trying to do that all the time, or to minimize those compulsions, I might drink more or do drugs or something. Like, the thing is, I'm curious if there's like certain ways in which people who really, really deal with OCD related issues try to numb down their compulsions through drugs or alcohol, for example.
Yes, it is one of the problems that can occur along with OCD is substance abuse, precisely to try to, as you said, numb their feelings or get their mind. Mostly their problem is their mind, the obsessions more than the compulsions, because if you can control the obsessions, since the compulsions are a result of the obsessions, they tend to be more easy to control once you get the control over the obsessions. So if substances are a way of numbing not only what you feel, but your mind as well, what you're thinking. Mm-hmm. So it helps, yes.
What is it that can really lead into having OCD? Is it like a trauma-related issue? Is it what could it be that instigates that behavior?
They have discovered that there are biological factors. For example, it has been discovered that when you have a close family relationship with OCD, you're more likely to have it. A parent, a sibling, even more if we're talking about of a twin.
Wow.
And they've also discovered that in a lot of cases, not all, a lot of cases present different abnormalities in the frontal lobe. For example, in the case of Howard Hughes, yes, he did have his obsessions and everything since he was a child, but he really got worse after his severe accident in which he almost died, because there was some organic result when he crashed, and that made him get worse. Of course, there's also factors of the family, growing up, whatever, that also contribute to the development. Usually, yes, those all the developmental experiences, yes, tend to be a result of trauma in a lot of cases, yes.
So a lot of things can stem from a very early age and like perpetuate for, other. It sounds like the way you're describing almost like a way of needing to have a certain type of control in your life, right? Mm-hmm. And when things are out of bounds or not within that purview of how you really want it to be, that sort of control, that's when you become more obsessive. Sounds like, no?
Yes. Actually, the average age of being diagnosed with OCD tends to be around 19 years old. So that means that you have even children being diagnosed or having the problem of obsessive-compulsive disorder.
19. Wow.
Yeah.
Quite young, no?
Yes, that's when it usually presents itself, the late teen years, very early 20s.
Mm-hmm. If someone around you, it really has, like, let's just say, for lack of a better expression, a really strong case of OCD, like they're just doing things that are just that seem from your eyes like over the top and they need correcting. How do you go about having that conversation with them to let them know, hey, it would probably be best if you sought help for this? How would you have that conversation?
I would probably go about it focusing on the deterioration that OCD has brought to that person's life. It would be very helpful, for example, if there would be like a very clear before and after. Before you used to go out with your friends, before you weren't locked up, before you would hand in your work on time, because it does tend to deteriorate. So if you can use that to a bit of comparison between before and how the situation is now, it might help them see that they do have a problem and that it could be useful to go for help. Once, if they were in my consultation room, the first thing I would do would be also give them psychoeducation, inform them of the problem, how they can go, what it's about, why they act the way they act, and above all, bring them hope, because it is one of the easier problems to treat. It's one of the most treatable illnesses there is.
Yeah. Well, yeah, and I guess it would just take. It helps probably. I imagine someone who's can help make you accountable to make sure that you can change those compulsions too, like over time. You know.
Another thing I would do was try to make them picture a better future. How would it look like if you didn't wash your hands 2,500 times a day? How would it look like if instead of having to go over your work 300 times, you only went over it once or twice and used that time to do other assignments you have to do in your work? You know, try to picture a life without that disease, also to motivate them.
That's interesting. I like that expression. Like, imagine what it would be without this thing, you know, and create the life you want. I think that's a really good message. And Alessandra, just as a final thought to ask you, and again, thank you so much for being on Spirit Live. It's always a incredibly insightful conversation, speaking with you and just picking your brain of knowledge, which is always great. You know, you have so many really helpful insights. So we really thank you.
I'm honored to be back. I enjoy our conversations, and I hope that they are helping other people.
Well, they always are. Believe me, they always are. Always really good feedback with that. So really thank you. And the last thing I want to ask you is, anyone listening to this who's maybe just listening to this casually as they're doing something, you know, and they're just listening to this for just their own good, right? Like, what if someone's really dealing with OCD, like in a way that's just driving their own self crazy today? Like, what kind of practical things, one or two things, could they do starting today to just start to get out of the habit of those sort of tendencies? What are just a couple simple points? Because things I don't like, sometimes I think if we try to always go to the grandioso big solution thing, that's great, but maybe someone needs to hear what they can do right now today, just do something different, you know, to move that energy differently, so to speak.
Well, obviously, for this type of problem, the best thing they could do is go to a cognitive behavioral therapist who can handle this type of problem. As I said, it's very treatable, especially with cognitive behavioral therapy. And if they want to start to do something for themselves today, they could start, taking a look at those thoughts, at those obsessions. They can write like a little table. And I'm looking here at my other notes for that table. A sec, please. Okay, here it is. Write down in a sheet of paper or in an Excel file, what things you can observe trigger those obsessions. Then in another column, what those obsessions are. Are they thoughts? Are they images? Are they intrusive thoughts? Then in another column, the catastrophic interpretation, or how you interpret those thoughts, those obsessions. And the fourth column, the compulsions that you do to counteract those obsessions. For example, something that they might find very triggering, especially now during the pandemic. I had to receive the groceries, and I'm terrified of even touching them because I might be infected with COVID. That would be the trigger, receiving a package that might be infected. What's the obsession? I'm going to get COVID. How do you interpret it? Okay, it's a thought. It's a catastrophic thought because a lot of people get packages nowadays and don't get COVID. They just wipe it off or whatever. And what would the compulsion be? Maybe precisely that. Maybe I throw a bottle of Clorox on it to disinfect it, not just wipe it off with a Lysol wipey or spray it, or I have to 20 times. Then it can, after I count those 20 times, then I can bring it in the house. Become aware of those thoughts. That's basically the idea behind this little 4-column table.
It's like having, it sounds to me like having a very intentional way of bringing awareness into exactly what you're doing and forcing yourself to recognize those actions a lot more deliberately, right?
Exactly. And a lot of times by doing this and seeing it in black and white, you're able to detach yourself enough to say, okay, this is ridiculous. Maybe I do need help. Or, okay, yeah, well, maybe I'm not gonna die if I clean the package only 5 times instead of 20. Mm-hmm. Or maybe maybe I do need help.
Yeah, well, it could be, and then over time, then you'll recognize, like, okay, well, I need to really get this in order to figure out the best solution for myself. Maybe, like you said, go see a therapist, and whatever that might be.
But always the first step in solving any problem is awareness.
Awareness and recognition, right?
Exactly.
Yeah, no, that's great. Alessandra, thank you so much for being on this episode of Spirit Live Again. It's always an honor. People always enjoy listening to you. And thank you so much again.
Always a pleasure.
And where can people connect with you, find out more about you, your work, reach out to you directly?
They can look at they can reach me through my Facebook page, psic, psic, Alessandra Saenz, or they can write to me at my Gmail, the same psic, psic, period, Alessandra Saenz at gmail.com. Or send me, basically those two. Or my WhatsApp.
Or okay, no problem. We'll include all your information in the description, the notes, and the pinned comments. So anyone interested who wants to actually work with Alessandra on a range of issues, really, that will especially related to behavior and psychology and everything else, she can really, really help you out. And you can definitely listen to this episode again and the other episodes she's been featured on Spearlift, where she's spoken about narcissism and other things that are really important topics. So I definitely encourage you all to connect with her, and she can definitely help you out. So Alessandra, thank you so much again. It's been a pleasure.
Thank you very much, Devin. My pleasure.
And we'll see you all in the next episode, and take care, everyone. Have a great day.